Right now on ASA TV, Healthcare at a Crossroads. Hi everybody, I'm Ed Hyland. Anesthesiology 2016 kicked off with one of the world's most influential thinkers.
But I actually think that we are entering a period where it's going to be really exciting and much more interesting and much more satisfying to be an anesthesiologist.
Porter, a professor at Harvard Business School, is widely regarded as the foremost authority on competitiveness and economic development. His strategy to fix healthcare focuses on value-based delivery. Porter says value is created by caring for a patient's medical condition over the full cycle of care, and that measurement should weigh outcomes and costs.
What are the outcomes that we influence? We have a long history in this field of survival and safety in the operating room because of deaths. Remarkable things happen. A lot of fields, have worked on mortality. We're way beyond that now. We have to start thinking about what other outcomes really do we influence or could we influence if we're thinking systemically in a value-based way.
Porter says value is achieved with IPUs, or integrated practice units. These focused teams can provide the best care for their individual areas of expertise. Porter encourages anesthesiologists to see how they fit into a care team for a condition to collectively influence outcomes for patients.
We've got to stop protecting our traditional roles and get ahead of this and do the things that we can do the best and do the things that stretch us and where the complexity is something that we can master.
I think anesthesiology, much like the rest of medicine, has to fundamentally rethink about what their position is in the patient care chain. We need to be more middle managers or process engineers for healthcare rather than just specialists focused on anesthesiology.
Well, it's kind of a different way of thinking about the importance of anesthesiology and how it fits into this huge medical complex process that we are finding ourselves in. And this value-based medical care, I think, is going to be important with the changes that are facing medicine in the future, and we kind of need to be on the cutting edge of this development.
Physician anesthesiologists are poised to lead the future of healthcare and bring their unique skills to the executive suite. The demand for physician executive leaders in health organizations is unprecedented. With firm roots in patient safety, anesthesiologists are positioned to fill the leadership gap. Attendees found helpful encouragement and advice from this panel.
Presently, I'm involved in several committees in my hospital. There are about 5 different committees, and sometimes I wonder about being involved in those committees because they're time outside of the ORs. They are uncompensated time, but I realize that there's a lot that I can gain besides making contribution to those committees. There's a lot that I will gain personally. It was very, very inspiring to hear how they started off going to these type of committees, and they took a lot of risks.
A lot of the times, like someone else was saying, we don't like to go to meetings too much, but the interesting thing is that's where you form personal relationships, that's where you form trust, so it's crucial.
How can ASA help fight the opioid prescription abuse epidemic? This session looked at the swing from undertreatment to the overtreatment of chronic pain in the last 2 decades. Just this month, the DEA stepped in with guidelines aimed at reducing opioid production by more than 1/3 and offers a challenge to physician anesthesiologists for proactive treatment.
So we as perioperative physicians have a key role in utilization of multimodal regimes to try to curtail the number of opioids prescribed to these patients so that we can decrease the number of pills that are being in the open market and thereby decrease the opioid epidemic.
The Connection Center helps you engage, recharge, and explore Anesthesiology 2016. You'll discover the best products and services from hundreds of exhibitors. New in the Resource Center, the Digital Product Showcase features the latest offerings from exhibitors on an electronic billboard with interactive kiosks. It also includes product and innovation presentations, as well as scientific and educational exhibits with the latest industry research. Unparalleled education is a big component for the attendees at the Anesthesiology annual meeting. Tailored tracks make it easy to seek out customized information. This roundtable discussion focused on awake craniotomy in a patient with obstructive sleep apnea. Participants walk through anesthetic implications and intraoperative challenges in such a case. The Ellison Pierce Lecture discussed the past, present, and future of safety and risks for anesthesia and surgery in low-resource settings. Dr. Alexandra Hannenberg's wide-ranging presentation included implementation science, which is better use of simple, known ways to decrease morbidity, like hand washing, to sending surplus biomedical equipment from hospitals abroad.
And an enormous proportion of the equipment donated is so inappropriate for the setting receiving it that no more than 30% is ever put into service. And those devices that are used don't stay useful for long. At any given time, 40% is not functional, and the more complex and sophisticated, the more likely to fail.
Attendees are exploring the benefits of ASA's own Anesthesia Quality Institute. This session delved into leveraging AQI's NACOR for research and practice management, with an increasing emphasis on data. NACOR, the National Anesthesia Clinical Outcomes Registry, can help physician anesthesiologists improve their own practice.
I think it's really critical for us as anesthesiologists to learn how best to use the data, to think about opportunities for improvement, but also to share the value of our services to both the community at large, patients, other physicians, health systems, employers, and whatnot.
There is a special opportunity this week to come together for a cause. A groovy night of dinner, drinks, and dancing will support these 4 ASA foundations and include a performance by Beatles tribute band, the Fab Four. Sunday's event begins at 6 p.m. in the Hyatt Regency Chicago Grand Ballroom. Even if you missed the opportunity to get tickets, you can still show your support with a text donation to the foundation of your choice. Text one of these keywords on your screen to 50155. For every dollar donated through this text campaign, the New York State Society of Anesthesiologists will match up to $10,000. There is still plenty to see and do here at Anesthesiology 2016, and we'll bring it to you this week. For now, we'll leave you with some of the sights and sounds from the welcome and wine reception. I'm Ed Highland for ASA TV.